We're happy to have in studio with us the Health Cabinet Secretary James Macharia. Thank you for making time. An important month, October, for cancer, and we've seen people coming together to try and address the issue. I'm going to go into Kenyatta National Hospital, the infrastructure around cancer care and obviously other care for people. But first, I must ask you, a few weeks ago on Sunday Live, we hosted Governor Peter Munya, and there was a feeling, or he came out very strongly saying that the Health Cabinet Secretary is not available to them, not available for meetings, is arrogant and difficult to work with. Let me ask you this, James. What is your relationship with the governors and how do you respond to that?
Well, Julie, thank you very much for inviting me to the studios. It's always a pleasure to come here.
Thank you. Thank you.
I think the truth of the matter is that we have a very cordial working relationship with the governors, the Council of Governors. That's why we're able to implement projects like the one we did, we launched in Machakos in July. We do not want to discuss politics, things to do with the health sector, because the health sector is very sensitive. And you may have noticed deliberately, when Governor Munya has been raising these issues, we have deliberately actually not responded, because to the Kenyan patient, they're not interested in politics. The patient at Kenyatta National Hospital in the benches, the patient in Meru, in Turkana, they don't care and they don't even want to know the difference between the services by national government and by the counties. All they want is health services. So what we've done to do, what we try to do is to make sure we provide exactly that.
So let's go into the discussion on health services. And in some hospitals in this country, there's a feeling that, it's shambolic. We're looking at Kenyatta National Hospital particularly. Recently, a young man spent 18 hours in an ambulance. That's just an example of one of the things that's happening. There's a lack of ICU beds. The hospital has 21. It needs 100 beds. Long queues, a lot of inefficiencies. Who's accountable for all this, and what are you doing to ensure that this is streamlined and efficiency injected into the system?
I think the first thing to do, and the most effective strategy, is basically to make sure that the county hospitals are equipped, to make sure that we decentralize the health services. Kenyatta Hospital is congested with 2,500 patients. The reason being, patients are being referred to Kenyatta National Hospital from the counties, even for very ordinary illnesses. Now, what we are trying to do is to work backwards and say you need to deal with the county hospitals first to make sure that Kenyatta is a truly referral hospital. That's why we brought this project of 38 billion shillings, whereby we're equipping 2 hospitals per county. If we do that, like we did in Machakos, we launched in Machakos, where you put ICU, equipment, you put theater equipment, you put laboratory equipment, then those patients do not have to come to Kenyatta.
What is the status of that project? How many counties have accepted it, and where is it working?
Last count, we had 45 counties. 45
counties?
Out of 47, as a matter of fact.
So which 5 have not?
No, only 2 have not.
Only 2? Oh, yes, 45, yes. So which 2 have not?
I will not go into those details, but it's pretty obvious, the ones are yes.
On Citizen Roadhog, we teach that naming and shaming is the way to go.
If they don't do it in the next maybe 4 months, 4 weeks, I could be able to disclose that.
Okay.
But I don't want to shame them.
So it's happening, it's ongoing. Let's talk about the health bill for a moment. And the health bill 2014 was set aside. Health Bill 2015 introduced. There's been a little of concern from governors who are saying that the CSU would have the power to unilaterally appoint officers. They're also feeling that it sidelines the county governments in implementation. What are your responses to those?
Julie, the health bill was actually developed having consideration of the state of affairs in the country. Also considering what it says in the Constitution. For example, one very important thing which came to light this week is about that patient at Kenyatta. Right. Because that patient was denied medical services in a few private hospitals. Now, this bill, one of the things it is trying to introduce is to criminalize such action, so that somebody will be fined or taken to jail for 12 months if you deny any patient medical support.
Private hospitals will be required to admit people who are in serious need.
If they don't, it will be a criminal act not to do so. Right. So this bill is very important. We introduced it ourselves, actually. 2014. It has gone through Parliament. Now I believe it's in the final stages. But the bill was introduced by us as the Ministry of Health. Then it went to Cabinet, approved. It went now to Parliament. So it's our bill. And I will believe that in the next few weeks, it will be finalized. I'm told the governors went to meet the Health Committee in Parliament, and they supported it after mutual discussion with the members of Parliament.
You're moving on, we're saying. It's happening. And
it's happening.
Okay, let's go to cancer now, which is where we started. Concern still, too many people leaving the country, even as you're equipping the county structures to deal with treatment of basic conditions. The huger issue of cancer and other lifestyle diseases remains a big concern. What's the plan?
Well, 2 years ago we did an assessment, and we came to determine that indeed cancer and other what we call non-communicable diseases, diabetes, cardiovascular diseases, we realized it was actually on the rise in a very big way, not just in this country but globally. For example, every year we have about 14 million people globally being affected by cancer. 8 million die. Here, about 40,000 every year, and 25,000 die. So 2 years ago we decided, as we are formulating this new project which I mentioned, of 38 billion, we made sure that the biggest portion went to those kind of diseases. Renal dialysis machines. We decided to actually include about 245 of those machines. We also decided to include ICU beds in every county, 5 beds per county additional. We also decided to include cardiovascular machines as well, and cancer. In total, 70% of that 38 billion is going to answer those 3 diseases.
The people at home wondering, where is it operational? Where is it happening? How can they find out? So are any of the hospitals actually providing cancer care at county level right now? And if so, which county?
Now, if you go to Machakos, you see what they're doing, because we launched that in July. But I have to commend Machakos County, because they're very proactive. In addition to the machines, they went and spent adding 8 million extra to put good infrastructure so that the patients going there could feel they're in the right place. Maternal, child health, they all made sure that those additional facilities were put in place.
Provided.
But it's being provided. In fact, when we went there to launch with the president, it was tested, because we had to even do what we call electronic interface between Machakos and Kakamega. Because you see, one thing, Julie, cancer machines are very, very expensive. In addition to what we are doing in those 47 counties, we are also establishing what we call specialist cancer treatment centers. Those are very advanced, and so we cannot put in every county. We are putting 5 of them. One in Nairobi, Mombasa, Nyeri, Kisumu, and Moi Eldoret. When
do people get the relief of treatment from those centers, Bonus?
They should be ready in the next 3 months.
Next 3 months.
Next 3 months.
Going into 2016.
Because we're working together with the World Bank, IFC, and private suppliers, Varian and GE.
It's been challenging implementing. There's also, and my final question to you, there's a feeling that national government, that your ministry gets quite a big chunk of budget. How exactly is it spending its own budget? What are you doing in terms of your ministry in raising healthcare standards across, for the country?
I was surprised when I heard somebody say that 50 billion just for 2 or 3 hospitals.
Yes, that is what has been claimed.
Of course, that's not true, because within the ministry, we have Moi Referral, Kenyatta, spinal injury, we have Mathare. Also, more importantly, we have other institutions. We have like KEMSA, buys drugs. We have like KMTC. We have about 6 other institutions which are in the ministry, which actually have to take part of the budget. And also, in terms of some diseases like HIV, malaria, tuberculosis, immunization, all those are the health ministry head office. And so that budget, which is not actually 50 billion, is actually less, goes to cater for those interventions.
Thank you for joining us, Bwana CS. It's been a pleasure to have you. What's your final word to Kenyans on what they can expect in terms of healthcare? It's been couple of years down the road now, a lot of work being done, still many people concerned that, they maybe can't get the treatment that they would want. When do we start to see the tide change?
Well, it's already changing because, as I said, already we have launched a project. And in the next 3 months, we shall be having 10 additional hospitals, like Machakos, also fully equipped and operational. The idea is by early next year, we have the entire 47 counties covered.
Operational.
But that was very important. I think I have to mention this because I'm also in charge of transport and infrastructure. In fact, I thought I was going to discuss infrastructure.
This is Cancer Month. This is Cancer Month.
It's extremely important because in terms of transport,
right.
Most of the people in the rural areas, they don't get to the health facilities because of lack of transport. The government is embarked on a very ambitious project of actually putting an additional 10,000 kilometers of tarmac roads.
These are
majority
for the feeder,
of those
for the feeder roads?
will be actually in the rural areas,
yes.
80% of them.
Yes.
And the project will be launched actually this month. In the next 3 months, we shall be launching about 3,600 kilometers. Because it's very important to make sure that Kenyans in the rural areas are served, to make sure they can produce their produce and take it to the market. And that's where GDP is anyway of the country. So we are doing what we can. And of course, next time ask me about the SGR as well.
The
railway coming from Mombasa,
big transformation
all
for
the
this
way
country.
to Nairobi, all the way now to Naivasha.
Thank you. The importance, of course, of roads and infrastructure is it opens up the economy. And many people say, why spend money on infrastructure when we have other basic problems? Because infrastructure makes a huge change. And as the minister, just a message from many of the people who've been struggling in areas where cattle rustling is occurring and have been asking, give us roads. If you can access us, we are safe. How soon do we see places like Kapedo getting
Let me tell you what you've done, Julie. The first batch, already the bids have come in. And in fact, that will be launched before 20th of October this. And what we've done is to spread the roads from across the country, northeast, northwest, south, central, across the countries. All counties have been given new roads. Batch 1. Batch 2 will be done in November. So by the time we come to the first quarter of next year, we'll be talking about 3,600 kilometers underway in terms of construction. Every part of this country.
Every part of this country does this, yes. And this is an important thing to hear on this show. Delighted to have you. Thank you so much. Can I also say one thing,
if you don't mind, about the Alex Mandaga case?
Yes. The young man who was in the ambulance
extremely unfortunate.
18 hours.
But we have established that those 18 hours were not spent at Kenyatta. They were spent with him being taken around private hospitals. Thus we've asked the Kenya Medical Board to give us within 7 days a report as what happened to this patient or victim of the accident. From the time of the accident to the time he died. Within 7 days, we want that report.
Thank you for that. And maybe share your views. Should private hospitals be compelled to give someone in dire need treatment? This could be important. It's a lifesaver. It's a matter of life and death. Share your views with us, 22422 on Twitter. It's at Citizen TV Kenya, at Julie Gishura. Pleasure to have you with us on Sunday Live. Pleasure to have you.
Again?
Yes, thank you. Asante sana.